Good afternoon. This is my Teach 1 assignment, Precision and Predictive Medicine. My name is Juniary Sanchez and my professor's name is Sanja Avramovic. The course is HAP 360 B01. The objective of this assignment is knowing what's the definition of precision medicine and if it can be done using non-genetic information, the definition of predictive medicine and what are the differences between precision and predictive medicine. Create a table showing the relationship between anxiety diagnosis and the other one is which medication has the highest success rate when the patient has anxiety diagnosis. Give your opinion about why it is difficult to understand which medication works for patients with generalized anxiety or depression. Okay. The definition of precision medicine, what is it? According to the Precision Medicine Initiative, precision medicine is an emerging approach for disease treatment and prevention that takes into account individual variability in genes, environment, and lifestyle for each person. This approach will allow doctors and researchers to predict more accurately which treatment and prevention strategies for a particular disease will work in which groups of people. It is a contrast to a one-size-fits-all approach in which disease treatment and prevention strategies are developed for the average person with less consideration for the differences in individuals. Okay, and there's a link where you can check more information about it. Examples of this: heart disease, for example, is influenced not only by genetics but also by age, diet, exercise, and stress levels. Another example: a person who needs a blood transfusion is not given blood from a randomly selected donor. Instead, the donor's blood type is matched to the recipient to reduce the risk of complications. And there are the links right there if you want to check more information about it. Okay, the definition of predictive medicine. What is it? Predictive medicine is a branch of medicine that aims to identify patients at risk of developing a disease, thereby enabling either prevention or early treatment of that disease. Either single or more commonly multiple analyses are used to identify markers of future disposition to a disease. And there's the link right there if you want to check more information about it. Here are some examples. Preconception testing, conducted on potential parents before a child is even conceived, allowing them to better understand physical traits and the risk of disease in their offspring. Another example, prenatal testing, using to look for disease and conditions in a fetus or embryo before it is born, generally offered to couples who have an increased risk of having a baby with a genetic or chromosomal disorder. Another example can be newborn screening, conducted just after birth to help identify genetic disorders that can be treated early in life. And there's the link right there if you want to see more information about it. Okay, the first step that you have to do for the assignment is go to Blackboard, look for the precision and predictive modeling assignment. At the top right corner, you're gonna see a message that says attach file. You're gonna click on it, you're gonna download it. After this, you're gonna open the file, and you're gonna go to insert. After pressing insert, you're gonna press pivot table and just click OK. Don't change anything about it, just click OK. The second step is choose on your right side, you're gonna find some fields, and on that field, you're gonna choose generalized anxiety diagnosis. You're gonna click on it. After this, you're gonna click on SIT and drag it into the columns here and value here. On the value one, you're gonna have to change it from sum to count, like shown in the picture. Next step. The third step is to divide the numbers from the last two columns. The third one, right before the grand total, you're gonna divide those two numbers right there, the 117, for example, and the 366. After you divide it, you're gonna get a result. The result is gonna be the success rate on that drug. With this, you're gonna have to do exactly the same process with the 6 drugs that you have left. So instead of SIT, you're gonna press on CT, and you're gonna keep doing the following steps, same thing, and it's gonna look like this. Those are the values that you're supposed to have, the totals of each one of them. You're supposed to have 7. Okay, this is how it's supposed to look like. And after this, is this step. Which medication has the highest success rate when the patient has anxiety diagnosis? Rate of success for generalized anxiety diagnosis. In SIT was 0.32, SER 0.27, BUP 0.21, CT 0.2, BNN 0.13, MIRT 0.13, and NTP 0. So we can see over here that the one that has the highest rate is a 0.32. And now we have to do exactly the same process, but instead of doing the anxiety, generalized anxiety, you're gonna have to do substance abuse. So basically on the fields, you're just gonna unclick the one that we have at first, and then you're just gonna click on substance abuse. You're gonna do exactly the same process as we did before. You click on the drugs, you change it to count instead of a sum, and you're just gonna divide the two last numbers from the second row, the row before the last one. You divide those numbers and you gotta get the total, and it's gonna look like this. So, which medication has the highest success rate when the patient has substance abuse? So, the rate of success for generalized drug abuse diagnosis was SIT 0.31, SER 0.22, BUP 0.38, CT 0, BNN 0.14, MIRT 0.14, and FTP 0. So the highest one on this one was BUP. Okay, so in conclusion, assess was the key factor in this whole assignment. It helped find the success rate on substance abuse and anxiety diagnosis. BUP had the highest rate in substance abuse success rate. SIT has the highest success rate on anxiety abuse. And in my opinion, it is difficult to say how patients are going to react to treatment. This is because it varies on every patient. It can vary on the age, it can vary on the health, it can be on the metabolism. It can depend on many factors. And this is my teach one. Thank you.